not flat.
Abhishek, the type of
Flat, हाँ.
flat.
Irregular.
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 It's not in the category of flat. Okay, it is irregular bone. Now this hip bone, it is the pelvic bone. Okay, when two hip bones they will join like this. Okay, sacrum is in between. ऐसे होगा sacrum इधर. So they will form this kind of cavity which is called as the. सारे लोग वीडियो नहीं बनाएंगे. Okay, so this is called as the pelvic cavity. Clear? Now can you see this line here? This one. Yes. This line and this line of another hip bone, they will form a demarcation line between true pelvis and false pelvis. Okay, below this line is the true pelvis and above this line is a false pelvis. Is it clear? Yes. And this line here, it is called as the arcuate line. Entirely a complete circle will form and this complete circle is called as the arcuate line. Now the arcuate line, it is a demarcation line between the true and false pelvis. ऊपर जो है that is the false pelvis and inferiorly here this is called as the true pelvis. Clear? So now this hip bone, it has three parts. Okay, this fan shaped part, it is called as the ilium. This fan shaped part is called as the ilium. Okay, now can you see this opening here? This is a foramen which is called as the obturator foramen. What is the name of this foramen? Is
obturator foramen.
Clear? Now anteriorly and posterior to this foramen there are two bones. One is this, which is a very thin bone. Okay, and this is a thick bone which is lying posterior to it. So this thick bone, it is called as the ischium, which is posterior to the obturator foramen, and this thin bone which is lying anterior to this obturator foramen, it is called as the pubic bone. Okay, so it means this hip bone is made up of three parts. Fan shaped part, which is the largest part, that is called as the ilium. Then anterior to obturator foramen, this is called as the pubic bone, and posteriorly this thick bone is called as the ischium. So these are three parts of the hip bone, and these three parts, they will unite at this fossa, which is called as the acetabular fossa. Okay, the name is acetabular or acetabular fossa. So all these three parts of the hip bone, they will join here and they will form this fossa here, which is called as the acetabular fossa. So all these bones, they will join at this point, which is the acetabular fossa. Now at this acetabular fossa, the head of the femur will articulate and it will form your hip joint. Here it means this acetabular fossa, it should always directed laterally. तभी तो आपका जो femur है, it will articulate with it. So this is the acetabular fossa, which is formed by the union of all three parts of the hip bone. जो ये ilium है, ilium will form the 2/5 part of the acetabulum. Pubic will form 1/5 part and ischium will form again 2/5 part. Okay, so this is about all these three parts of the
hip bone. Ileum, ischium और pubic.
Ischium and pubic. Okay, so when we are in sitting position, no, this bony part of the hip bone, it lies in contact with the ground. जब हम sitting में है ना, तो ground के साथ this portion will come in contact with the ground. That's why this is the thicker part here. Okay, because ये क्या करेगा, while in sitting position, it will bear your weight on
body
it. That's why we need the density and the thickness on this bone. That's why it is the thick bone. Okay, so this thick bone, it will always directed posteriorly and it is called as the ischium bone. Clear?
Yes, ma'am.
Now we will see the side determination of this bone. Hence it is a paired bone. Yes. So this fan shaped part, it will always directed upwardly. Then this thick part, it is always posterior inferiorly, and this pubic part, it will always anterior inferiorly. So one part of the hip bone is lying upwardly, that is directed superiorly, and two parts, they are lying inferiorly, one of which is lying anteriorly and one is posteriorly. Anterior-inferior is your pubic bone, which is a flat bone, and this is the ischium, which is a thick bone here. Okay, so these are three parts. Now ये तो हो गया upper end and lower end. You will put this part superiorly and these parts
Inferiorly.
inferiorly. Then anteriorly or posteriorly हो गया, pubic bone will lies anteriorly and ischium bone will lies posteriorly. Clear? Then this ischium bone, it has now we will discuss about the medial and lateral. Okay, what is the identification for the lateral? This acetabular fossa, it should always directed
Lateral.
lateral. So like this you can identify the medial and lateral. Okay, superior, inferior, anterior, posterior,
Medial.
and acetabulum is laterally and this is the medial. Is it clear?
Yes, ma'am.
So like this, if you will follow all these 3 points, you will come to know the side of the bone. Is it clear?
Yes, ma'am.
Yes, ma'am.
Yes. Now there is one more thing. When you will hold this hip bone in the anatomical position, you will always use your web space, which is between the index and thumb. This space is called as the web space.
And
You will stuck it here and then you will hold it like this. Okay. Now how you will hold this bone in anatomical position? You can hold it like this, but this is not the anatomical position. You have to follow the points. Okay. This is the pubic bone.
Posterior part.
This surface is called as the symphysial surface of the pubic bone, which will join with the
Pubic symphysis.
same surface of the opposite side of the pubic bone, and it will form a joint here, which is called as the
Pubic symphysis.
So this pubic symphysis, it is a joint of midline. That's why it is called as the symphysis. So you will see the direction of this pubic surface, symphysial surface of the pubic bone. It is always
Medially.
towards the midline.
Midline.
It is like this. If you will direct its direction towards the midline, automatically your hip bone will come in the anatomical
Position.
Suppose I am doing it like this. So this
Wrong.
is not the anatomical
Yes, ma'am.
position.
Straight
You
होना
have
चाहिए.
to keep it
Straight.
towards the midline and straight. Okay. So this is the anatomical
Anatomical
position
position.
of the hip bone. Once you will do it like this, then the second step, you will tilt your hand somewhat anteriorly.
क्योंकि
So
आगे
this is the क्योंकि इसका जो पोजीशन है that is somewhat tilted anteriorly. You can see in the
Yeah.
skeleton क्या होता है, somewhat anteriorly tilted होता है. So this is the anatomical position of the hip bone. Is it clear?
Yes,
मैम इसमें इलियम का पोस्टीरियर पार्ट भी मैम थोड़ा थिकर था मैम, इसमें नहीं दिखा
Ileum का?
यस मैम.
हाँ ये है ना.
इलियम का पोस्टीरियर यस मैम.
वो फोरामन का नाम क्या था?
Adductor.
This is called as the greater sciatic notch.
ओके मैम.
ये जो है this is a notch. बड़ी है तो
Greater.
greater. Sciatic क्यों कह रहे हैं? There is a nerve which is sciatic
Sciatic
nerve
nerve.
which is passing through this foramen. That's why this notch is called
Fossa.
as the greater sciatic